Hashtag Anti-Inflammatory. A Silent Fire, the story of inflammation, diet, and disease. Every book, a new way of seeing the world. Hey everyone, welcome to the show. Today we're reading A Silent Fire. Chronic inflammation is the hidden root of almost every modern disease. Here's what science says about how to put out the fire. You've probably heard of all kinds of healthy eating trends, anti-cancer, anti-sugar, antioxidant diets. Lately, there's a new one, the anti-inflammatory diet. Kale, blueberries, olive oil, fish oil, these are all recommended foods. But what exactly is this inflammation we're trying to fight? And how does it relate to the inflammation we already know, like a wound getting red and swollen or appendicitis or gum disease? The book we're discussing today, A Silent Fire, clears all of this up. The author is Dr. Shilpa Ravella, a professor at Columbia University Medical Center and a gastroenterologist. Her research focuses on the interaction between food, the gut microbiome, and the immune system. She also regularly explains medical knowledge in major media like the Wall Street Journal and The Guardian. In this book, Ravella combines clinical experience with medical research. She walks us through the history of inflammation science, connects inflammation to all kinds of serious diseases, and gives us practical health advice. One thing stands out. She puts huge emphasis on nutritional therapy, using nutrition to prevent and treat disease. And the basic principle behind that, controlling silent inflammation in your body. So, what is silent inflammation? Like the English title says, it's a silent fire. The mechanism is similar to acute inflammation, but you can't feel it day to day. Even standard tests might not catch it. This chronic immune response can speed up aging and lead to heart disease, cancer, diabetes, obesity. The mechanisms behind it only became a focus of medical research very recently. The book's subtitle gives us some clues. The story of food, microbes, and disease. Let's follow those threads. First, what is inflammation and what diseases is it linked to? Then, how does silent inflammation work at the cellular and microbial level? Finally, how can diet help us control it? Hashtag 1. What is inflammation? First, let's get clear on what inflammation actually is. The original Latin root of inflammation means to set on fire. In Western medicine, inflammation has 5 classic symptoms: redness, swelling, heat, pain, and loss of function. The Roman physician Celsus first grouped the first 4 around 25 AD. A century later, the Greek physician Galen explained inflammation using the humoral theory, the idea that bodily fluids out of balance cause disease. His ideas dominated Western medicine until the 19th century. Then came 2 scientists who changed everything, Rudolf Virchow from Germany and Elie Metchnikoff from Russia. In 1858, Virchow published Cellular Pathology, explaining inflammation at the cellular level for the first time. He described how increased blood flow causes redness and heat, how fluid and immune cells seeping into injured tissue causes swelling, and he added the 5th symptom, loss of function. He also correctly guessed that white blood cells drive the inflammatory response. In 1882, Metchnikoff discovered macrophages, cells that swallow harmful invaders, while observing starfish larvae. He met Virchow the next year, and together they realized something profound. Inflammation isn't purely a disease. It's a beneficial immune response where the body fights invaders. This became the foundation of modern immunology. Here's how the immune system works in 2 parts. The innate immune system is your first line of defense, physical barriers like skin, and nonspecific immune cells like macrophages and neutrophils that swallow anything harmful. The acquired immune system is more sophisticated, unique to vertebrates. Its key players are lymphocytes, B cells and T cells that precisely identify threats and generate specific antibodies to neutralize them. When you get injured or infected, acute inflammation kicks in. Innate immune cells rush to the damage site and release signaling proteins called cytokines to mobilize reinforcements. They also carry information about the invader to the acquired immune system, which then produces targeted antibodies. Normally, this process resolves in a few days. But when the damage never fully heals and the immune response keeps going, it becomes chronic inflammation. When the symptoms aren't obvious, it's silent inflammation, continuously flaring up inside your body. To summarize, inflammation is an immune response, can both fight invaders and cause collateral damage. Silent inflammation is what happens when the trigger is never fully eliminated, and the body stays in a long-term inflammatory state with all kinds of side effects. Hashtag 2. What are the dangers of silent inflammation? Next, let's talk about the health risks linked to silent inflammation. You could say silent inflammation is both the underlying mechanism for overall health risks like aging and obesity, and a direct cause of specific chronic diseases like diabetes, heart disease, and cancer. First, the relationship with aging. As early as when Metchnikoff discovered macrophages, He suspected they participated in aging, but it took over a century to confirm. Italian researchers Ferrucci and Franceschi found that a cytokine called IL-6, a protein that attracts macrophages to inflamed areas, could predict the speed of aging. The higher the IL-6 level, the higher the chance elderly people would become disabled within 4 years. Other inflammatory markers were linked to higher risks of chronic disease, disability, and death. In 2013, Franceschi proposed Inflammaging, now recognized as a key mechanism driving human aging. So-called Inflammaging refers to hidden inflammatory states during aging. The body accumulates biological debris, damaged cells, misfolded proteins, broken molecular fragments, triggering the immune system to clear the garbage. Damaged cells may enter a senescent state. They neither self-destruct nor self-repair, just muddle along, constantly releasing inflammatory cytokines throughout the body. At first, it's a slow-burning fire, but after long-term accumulation, aging accelerates like an avalanche. 2 typical cases. First, bone loss and arthritis. Previously thought to be simple wear and tear, osteoarthritis is actually autoimmune inflammation from long-term mechanical damage in joints. Macrophages migrate into joints and indiscriminately destroy bone cells, actively promoting bone breakdown. The same happens with muscles, causing age-related muscle loss, which is why elderly people fall more easily and suffer serious fractures. Second, Alzheimer's and other dementias. Scientists recently linked Alzheimer's to inflammatory responses. Alzheimer's brains accumulate amyloid plaques and tau tangles, but some people have these without showing symptoms, meaning they're not the root cause. The real culprit involves microglia, the brain's macrophages. In Alzheimer's brains, microglia become hyperactive, releasing cytokines and calling immune cells from across the body, causing chronic inflammation. As nerve cells inflame, memory and learning decline, and more plaques accumulate. Even ordinary infections like periodontitis increase dementia risk. Critically, high inflammatory markers in middle age predict reduced brain volume and memory problems decades later. Speaking of this, we also need to talk about the relationship between obesity and silent inflammation. That's right, fat also triggers silent inflammation. Starting in the 1990s, scientists discovered fat tissue contains many inflammation-related cytokines. By 2003, scientists found through mouse experiments that inflammatory factors in fat are mainly related to macrophages, and the number of macrophages in fat is proportional to fat cell size and body weight. The fatter you are, the more severe the inflammatory response caused by fat. In thin people, macrophages around fat are relatively scattered. But in obese people, fat cells pile up together, and macrophages gather there too, more easily triggering inflammation. These crowded fat cells, because they've stored too much lipid and can't work normally, with cell structures on the verge of collapse, have to spit out harmful contents, releasing cytokines which attracts more macrophages, forming a vicious cycle of inflammation. The author describes this silent inflammation as burning very low, smoldering chronically, able to escape detection, yet like gasoline splashed everywhere, just waiting for a spark to ignite. Scientists call this metabolic inflammation. Not only that, the location of fat distribution matters. The most dangerous is fat around the belly. Thighs, buttocks, or upper arms are basically harmless. Too much abdominal fat indicates too much visceral fat, more easily triggering bodily inflammation and various complications of obesity, like diabetes. A 1996 study found that insulin can be damaged by cytokines from inflammatory responses. And if the pancreas accumulates too much fat, it can cause chronic inflammation. The inflammatory cells there ignore insulin instructions, prompting the pancreas to secrete more and more insulin, pushing glucose into tissues, causing diabetes. Understanding the relationship between silent inflammation and obesity and aging, it's not hard to understand why the 2 biggest killers of modern human health, heart disease and cancer, both have its shadow behind them. Scientists discovered one of the major causes of heart disease as early as the mid-20th century. Lipids like cholesterol accumulate on blood vessel walls, further causing calcium deposition and fibrous hyperplasia, so blood vessels gradually narrow and harden, medically called atherosclerosis. In 1986, American medical researcher Peter Libby first discovered that inflammatory factors promote atherosclerosis, but it wasn't until the 1990s that the academic community reached consensus. Atherosclerosis isn't just fat accumulation, it's an inflammatory disease. Specifically, low-density cholesterol particles cause cellular damage on the inner walls of blood vessels. You can probably guess what happens next. Macrophages rush to the rescue but can never finish eliminating the cholesterol particles, so they accumulate on the fatty plaques inside blood vessels, making them more prone to accumulation and rupture, causing heart attacks or strokes. By 2011, cardiologist Paul Ridker used a specific antibody drug, canakinumab, that specifically blocks an inflammatory factor that promotes atherosclerosis. It reduced patients' risk of heart attack, stroke, and cardiovascular death by 15%. That was the first evidence that intervening in inflammation alone could improve heart disease. Magically, the drug Ritger used also reduced patients' risk of dying from cancer by 50%, including a 75% reduction in lung cancer. So let's talk about the relationship between inflammation and cancer. Interestingly, the original pronunciation of cancer was the same as inflammation. Later they changed pronunciation to distinguish the two diseases. Unexpectedly, science eventually reconnected the two words. A 2010 study found at least 1/4 of all cancers originate from obvious chronic inflammation. More and more research on cancer cells finds that tumors can trick the immune system, using the mechanism of inflammatory response to expand. For example, macrophages have a cytokine that promotes blood vessel growth, originally to stimulate blood vessel formation and help wound healing. Cancer cells also massively secrete this factor, letting new blood vessels feed the tumor. They also turn macrophages, making them produce immune-suppressing molecules, protecting the tumor from immune system damage, or secreting growth factors, promoting uncontrolled tumor growth. Some turned macrophages also carry the skeleton of cancer cells to other parts of the body, like they'd swallow dead cells and debris from a wound, causing tumor metastasis. The author says, precancer inflammation promotes cells toward malignancy, or influences early growth, while cancer-induced inflammation makes it continue growing and spreading. The author has a good summary of inflammation's effects. Acute or chronic, silent or overt, their pathways and subjects depend on where in the body, why, and how it inflames. A sprained ankle will produce the redness, heat, swelling, and pain Celsus described. The cough and runny nose of a common cold are products of mucosal inflammation in the nose and throat. Influenza virus will ignite systemic inflammation, causing muscle and joint pain. Chronic, silent inflammation looks and feels different from overt autoimmunity, but it is still the same author, the same creativity wielding the pen. #3. How to fight silent inflammation. By now, you might be thinking, silent inflammation affects human health so broadly, so how can we prevent and control this hidden fire in our bodies? The author proposes many methods, including anti-inflammatory drugs, improving the microbial environment, and reshaping diet. Let's first talk about the most direct drug therapy. Here's a warning. Many people treat amoxicillin, cephalosporin, and other antibiotic drugs as anti-inflammatory drugs. But these are actually antibacterial infection drugs, not targeted at the inflammatory response. Modern anti-inflammatory drugs should really be called anti-inflammatories. And there are two kinds. One is steroid drugs, also called steroidal anti-inflammatories. They mimic hormones naturally produced by the body and broadly suppress the immune system. So while they can reduce inflammation, they can also worsen infections. The other is nonsteroidal anti-inflammatory drugs, or NSAIDs, including aspirin, ibuprofen, and so on. They block the body from producing prostaglandins, which trigger pain and fever. But this has a cost. Prostaglandins also have the function of protecting the stomach. So abusing these anti-inflammatories may cause stomach ulcers. The principle of both drugs is to fight the inflammatory response, to suppress the immune system that's trying to protect us. This is a massively complex system accumulated through hundreds of millions of years of evolutionary history. Touch one part and the whole body moves. There's always some risk. Fortunately, while understanding the mechanism of inflammation onset, scientists have gradually understood the mechanism of inflammation resolution, and this provides the basis for real anti-inflammatory drugs. They discovered that cells participating in acute inflammation, like macrophages and neutrophils, switch on a mechanism when inflammation resolves. They release a new chemical substance that starts the work of cleaning the battlefield and post-war reconstruction, shifting from promoting inflammation to reversing it, promoting the healing response. Scientists call these factors pro-resolving mediators. They can weaken tumor growth, improve cancer treatment, reduce inflammatory body fat, and prevent ischemic stroke and Alzheimer's. If we use these mediators to reduce inflammation, we're not fighting against the body's immune mechanism. We're strengthening these special immune pathways, letting the body more actively turn to self-healing. However, related drug development is still in its early stages. It'll be some time before they're actually in use. It seems medication isn't so reliable yet. Let's look at improving the microbial environment. Here the author proposes a term called dirty healing. What does that mean? Simply put, the environment shouldn't be too clean. You need to appropriately introduce more complex microbial environments to train an immune system with stronger resilience. The author reminds us that the formal definition of hygiene is conditions and practices that help health. An overly clean environment makes our immune system like a frog at the bottom of a well. It reacts too strongly to external substances, with higher risks of producing inflammation and allergic reactions. Research shows that if children are exposed to larger amounts of microbes during infancy, their risk of silent chronic inflammation in adulthood may be reduced. Besides letting babies get maternal microbes through natural birth and breastfeeding, the author also recommends lowering personal and family cleaning standards a bit, showering less frequently, keeping more plants and animals at home. She especially recommends using soil from nature or organic farms when planting. It contains more natural microbes and fewer chemical residues and drug-resistant bacteria. This microbial environment is actually also related to dietary therapy, since the body's largest microbial environment is the gut. Since we eat constantly every day and external substances keep entering the gut, the immune system there bears a heavy identification task, deciding who should be eliminated and who are tolerable probiotics. Gut flora can help us identify dangers by talking with immune cells, and they can also help us fight inflammation so we don't get diarrhea every day. But if our gut microbial environment is already out of balance, it may produce broad and long-term inflammatory responses. Then you need to use fecal microbiota transplantation therapy, making pills out of feces donated by volunteers for patients to take, letting the body ingest some healthy flora. This might sound a bit disgusting. You might also be asking, isn't there a more delicious dietary therapy? There is. The author reminds us that the rapid surge of many chronic inflammatory diseases in the past few decades is largely the result of modern lifestyles. Modern eating habits place too much burden on our immune systems, causing silent inflammation. How to change it can be summarized into 2 suggestions. First, be careful to eat less processed food and eat more whole foods. That's because many ingredients in modern processed foods may cause chronic inflammation. For example, hydrogenated vegetable oil contains trans fats, which are linked to many chronic low-level inflammations and may worsen atherosclerosis caused by cholesterol. Also, snacks like spicy strips contain excessive salt, which disturbs immune cells and releases large amounts of inflammatory molecules. Large amounts of refined carbohydrates, like refined grains and drinks added with corn syrup or refined sugar, cause blood sugar to spike and crash, making the vascular endothelial cells produce less nitric oxide, while macrophages in fat tissue produce more inflammatory cytokines. Also, artificial sweeteners and emulsifiers in ice cream, cookies, and jam all change the behavior of gut flora, causing gut mucosal dysfunction, triggering chronic inflammation and metabolic syndrome. In contrast, so-called whole foods are foods closest to their natural state, like whole oats, whole corn on the cob, that kind of thing. The author emphasizes that diet cannot be simplified into proportionally matched nutrients. Complete foods contain extremely diverse nutrients, meeting the needs of different systems in the body, and the sugar conversion process is also smoother. Especially the various fibers they contain are more in line with the natural tastes of gut flora, helping maintain balance. Second, eat more leafy green vegetables and avoid excessive intake of animal meat, eggs, and dairy foods rich in saturated fat. Different vegetables have their own unique fibers. Soluble fiber, after fermentation in the gut, can promote more diverse flora, also stimulate microbes with anti-inflammatory behaviors, control bad immune responses, and effectively squeeze out or defend against pathogens. For example, producing various short-chain fatty acids to induce immune cells to lower their response and strengthen the gut mucosa. If you want to take in more healthy fiber, the author recommends legumes, oats, nuts, seeds, and so on. In addition, the author specifically mentions that dark leafy greens, colorful berries, and tea can heavily provide a component called polyphenol. Research shows plant foods rich in polyphenol can reduce inflammatory markers in the blood and help prevent various chronic inflammatory diseases. As for animal meat, eggs, and dairy, most contain saturated fat, which drives macrophages to inflame and activates various inflammatory factors. You can't eat too much of it. Here's a warning. The most common saturated fat isn't in fatty meat, but in butter, cheese, milk, meat, and palmitic acid in palm oil. Correspondingly, fish, olives, nuts, and other foods contain more unsaturated fatty acids that can promote inflammation resolution. Also, anti-inflammatory foods you can eat more of. The author also reminds us that when processing these ingredients, use more gentle cooking methods like steaming, sautéing, stewing, boiling, blanching, or light roasting. Eat less food cooked under high heat and almost no moisture conditions, like barbecuing, deep frying, searing, roasting, and pan frying. That's because high-temperature cooked food, especially high-fat animal foods, very easily accumulate substances that trigger inflammatory responses. #conclusion. In the end, we must emphasize that current research on silent inflammation is still at the stage of the blind men touching the elephant. Besides what's covered above, many factors worsen silent inflammation: air pollution, lack of exercise, and so on. There's even new research showing inflammation also affects mental health, including depression, suicide, anxiety, PTSD, schizophrenia, bipolar disorder, and autism. However, this fire looks scary, but in the not-too-distant future, we may be able to use pro-resolving mediators and gut flora drugs to achieve what the author calls an optimal inflammatory state, where the immune system neither overreacts nor underreacts, strengthening immunity while avoiding autoimmune diseases and other chronic diseases. We can't blindly pursue an anti-inflammatory diet. We need to remember that inflammation can cause harm, but it's also the body's healing process. We're not fighting against our own bodies, we're reducing the burden on our bodies. We're coordinating with the natural environment, letting our own microbial environment and immune system have stronger adaptability. Just like the author says, the burden of silent inflammation and chronic inflammatory diseases forces us to re-examine all factors in the modern environment, no longer seeing health as the presence or absence of one or several different diseases, but as a state of existence that can maximize human potential. As the environment continues to change, the interdependence at the core of the situation becomes increasingly obvious. The health of humans, microbes, and the earth are inextricably linked. That's it for today's episode. If you enjoyed this, do subscribe. Every book, a new way of seeing the world. See you next time.